So just a word about the background material in your packets. This is valuable information, fact-based information you may need to feel more confident about writing about this very complicated subject of Medicaid. But let's begin. First of all, I'm Sandy Close, the founder and director of American Community Media, formerly known as Ethnic Media Services, formerly known as New America Media. We evolve, and I think what's exciting is that we now really have a name that represents all of us, American Community Media. We know we're at a time where there are trigger words that the federal government has wiped off their websites and warns people, don't use these trigger words. We decided to take advantage of this to strengthen how we wanted to describe our media, American Community Media. We are not others, we are American. We are community, because more than any other sector of journalism, we are one and the same as the audiences we serve, and in media of all types. So with that said, let me introduce our subject and our panel. Nothing is more important for our audiences than how they handle health, their own health and that of their families, and the health of the communities. And for 1 out of 3 Californians, healthcare depends on Medicaid. We have heard much discussion about the possibility of huge federal cutbacks in Medicaid. What will they mean to the communities all of us serve? What will they mean in terms of individuals on Medicaid? People who go to clinics that get funding from Medicaid. People who use hospitals that rely on reimbursements from Medicaid. All of this is complicated, but we wanted today to really hear from people on the front lines who will be most impacted. And we thank our partner organization, Fight for Our Health, which is a coalition of groups that organize to raise awareness about the stakes of cutting Medicaid. This has been a key issue for Ethnic Media Services, now known as American Community Media. So we jumped at this opportunity to have a real on-site community media seminar. And with that, let me introduce our panel. Our opening speaker is Michael O'Day, who worked with us for many years in the early 2000s. He is the Senior Director, Health Policy Director at Children Now, a statewide research and advocacy organization. He will give us an overview where are we at with the decision-making about cutting Medicaid. How do we follow the complicated business of congressional meetings. How do laws get made? I, to this day, can't answer that question, but we need to know what to expect around the decisions that will ultimately affect Medicaid. Then we're joined by Dr. Q, who is the pediatrics department doctor here in Orange County. She will give a frontline perspective as a healthcare provider. And then we have some remarkable community spokespeople who will share their stories. Evelyn Rodriguez, who is a parent advocate and CEO with Latino Parents Mentors, and Michelle and her son William Del Rosario. We are going to end at 12 to make sure our television and radio reporters have a chance for one-on-one interviews, and also, of course, print and online. Okay, so with that, can I start with you, Michael? You have 8 minutes to tell us all we need to know about what could and could not happen with Medicaid.
Thank you, Sandy. Can you guys hear me okay? Is this on?
I think it needs to be.
Okay, great. Thank you.
You don't need to put it in stand if you don't want
Okay.
it.
Okay.
If you want to stand up, Michael, whatever.
I'll stay sitting down.
Okay.
First of all, thanks, Sandy, for inviting me. My name is Michael Day. I'm Senior Director of Health at Children Now, and as Sandy said, we are a statewide policy research and advocacy organization working to bring power to kids in California.
And remember to speak slowly.
Okay,
We
thank
don't
you.
have interpreters for everybody, but it's hard.
Okay, good reminder. So, like I said, we work to build power for kids here in California. Most of my work is focused on the Medicaid program, so that's what I'm going to talk about today. So Medicaid is California's version of the Medicaid program. Medicaid is a public health insurance program for children, adults, and seniors, and it is jointly financed by the federal and state governments. But each state administers its own program separately. So it all looks a little bit different, and that's why we call it Medicaid here in California. But like I said, it's a joint financing arrangement with the federal government, and that arrangement has been around for decades. It's now under threat by the current congressional plans to slash Medicaid funding. So to be very direct, Medicaid healthcare cuts hurt working folks, children with disabilities, expectant mothers, and seniors in nursing homes, but no one will be spared. Healthcare costs will rise, and access will shrink for everyone. Medicaid, like I said, known as Medi-Cal in California, is a lifeline for over 15 million Californians, providing essential care to California's families, seniors, children. 40% of births in the state are covered by Medi-Cal, helping kids get off to a healthy start. 5.5 million kids in this state are covered by Medi-Cal. That's 1 in 2. So half of kids in the state are covered by Medi-Cal, so it's huge. Medi-Cal for kids and teens covers comprehensive services, including preventive care, screenings, behavioral health, dental care, emergency care, and much more that kids need to thrive. We know that kids with Medicaid coverage have opportunities to succeed because kids in Medicaid do better in school, use fewer school days, are more likely to graduate from high school and go to college, have fewer emergency room visits and hospitalizations as adults, and earn more money as adults. Medicaid dollars are the largest source of federal funding to California. and makes up 1/5 of our state budget. Cuts to federal spending would leave the state with an enormous hole to fill. Last week, the House and Senate agreed on top-line contours of a budget agreement to make deep cuts to federal health spending. Right now, they are on a 2-week recess, and once they get back, the committees in charge will decide how, over the next couple months, they will decide how they're going to slash $880 billion in the next 10 years. Most of that is going to come from Medicaid because there's nowhere else to make those level of cuts, and this is going too far, too fast. Reckless cuts to critical programs in Medi-Cal would do nothing to make healthcare more efficient or more affordable. In fact, cuts to federal Medicaid spending leave the state with impossible decisions to make, to make up for the loss of federal dollars. If Congress cuts $880 billion over the next 10 years, California would lose roughly $13 billion next year. And just as a source of comparison, there were about $12 billion, over $12 billion spent on Medi-Cal just here in Orange County. So essentially, if we wiped out the entire Medi-Cal program in Orange County, is what the state could face next year. These are impossible cuts.
Michael, can you repeat the number you just gave for Orange County?
Yes, $12 billion.
$12 billion.
$12 billion in Medi-Cal spending in Orange County.
And that was in 2024?
I would have to double check that number, but
okay.
I think that.
It could be fiscal. Okay.
Yeah. So the congressional plans to slash the $880 billion from Medicaid nationally will not only compromise the health of the 15 million Californians that depend on it, but will destabilize the healthcare system for every Californian. Health clinics and nursing homes will close and healthcare workers will be laid off. I just saw an article today about how a local clinic is going to be scaling back on services due to loss of federal grants. That makes access to care less available. Hospitals would close, forcing people to travel further for care, and emergency rooms will be even more crowded. Healthcare will become more expensive for everyone if people are not covered, and as families are forced to pay more out of pocket for care, providers raise their costs to compensate for fewer Medi-Cal dollars, and businesses have to pay more to insure their workers. So in closing, I just want to reiterate that healthcare cuts hurt all of our communities, and the Medicaid cuts being considered in Congress will terminate healthcare for millions of Californians, including children, families, seniors who depend on nursing home care, people with disabilities, people fighting cancer, veterans, and home care workers. My message to our elected officials is simple: don't cut Medicaid. Thank you.
Let's take a couple of questions. The cuts that are being proposed to Medicaid are based on the charge that there is abuse, fraud, and waste in the system. That is the main argument. And I'm wondering, Michael, how you respond to that.
I think no one supports waste, fraud, and abuse in the system. Yes, there is waste, fraud, and abuse in every system. I think there's also ways that we have now that those are detected and dealt with. The Congressional Budget Office, which is the sort of independent analyst for Congress, looked at the budget proposal and said there is no way to get to $880 billion of cuts without deep cuts to Medicaid. So we're not talking about trimming fat of waste, fraud, and abuse. To get to that level of cuts would require cutting people off, less dollars, cutting benefits, etc.
And to what extent do public opinion polls show that Medicaid, and in California, Medi-Cal, is popular and people have strong feelings about what would happen if it's cut? What do we learn from the polling?
Yeah, I don't have the latest poll numbers with me, but I know there's strong support for Medicaid as a program nationwide and in California. like I said, because half of kids in the state are covered, it's a big program. A lot of families rely on it. So it's not something that people take lightly. And the thought of reductions to Medicaid, I think, are scaring politicians because people don't like that idea of their health care taken away from them.
Is there any sense of what Republican representatives in California, Republican congressional representatives have said or not said about cuts in Medicaid?
Well, most of them have voted for us to get to this point where $880 million target is what's on the table right now. There was a letter sent, I think, just yesterday that 2 of our moderate Republicans signed saying that they wanted Medicaid to be protected in the final budget. There's a few months between now and that final budget for those details to be worked out. So we'll see if they will actually stick to that. And one of those representatives is one here at Orange County, Representative Youngkin.
Okay, what question does anyone in the room have for Mike at this point? You will have a chance to interview him one-on-one, but any questions people have, or we will move to the next speaker. Yes, Tata.
Yeah, hi, my name is Fatma from an Intishar newspaper. My question is, I believe, in my opinion, this is a crisis for all community. How we could stop that as a media, and how the community gonna work to stop this action?
So what can we in the media do to influence those voters in Congress who will determine the fate?
Yeah.
What's your advice?
I guess my advice is help spread the facts that these cuts would be devastating for our communities, and it's there's a lot of talk so far about procedural votes that have gotten us here, but the reality is the cuts on the table are devastating and are only going to be harmful for our communities. And I think that our communities need to know that and make sure our elected representatives are hearing that. So I would say it's both educating communities and then having communities activated and organized to share that message to the decision makers. These are going to be some really critical months ahead.
This is one of those cases. Do you remember when John McCain came at the last minute when he was so sick because the Affordable Care Act was hanging by a thread, whether it was going to be renewed or terminated, and he walked into the Senate to cast the deciding vote? This is a case like that made me think of that what's at stake is how our representatives are going to vote on this, and we need to let them know we are very hopeful that they vote. I can't say everybody will agree on this, and I'm not asking you for your commitment on this. I'm saying what we need to let our audiences know is what's at stake. Okay, let's go to our next speaker, Dr. Quinn Q, with the Pediatrics Department of the Miyoko Medical Center. And I want to make sure you don't have trouble with the microphone. I am technologically not great.
I think yours is working, so I'll do that one now. So maybe you'll have to use this.
Okay, please use this. Dr. Q.
Thank you very much, Sandy, and thank you for opening the first talk about this issue, which is really essential to all of us. I'm Dr. Quinn Q, and I've worked in the community for over 45 years. I've been in pediatrics, and I recognize many of my friends in this room. And I'm here at the Người Việt News, and Người Việt News is the oldest Vietnamese language media here. And I remember when it started in the Little Saigon area. I'm here to speak for the children, and in a little bit I will ask your permission to say a few words in my own language, in Vietnamese, to give the appeal. So I take care of children from the minute they're born. Well, 40% of the mothers in California depend on the Medicaid services. Without Medicaid, we would not have safe delivery. And as we speak, I know 2 hospitals in Orange County are closing the OB services and maybe close completely. So what you have said, even before the cuts, it's already happening. So,
why is it happening before the cuts?
Because the rates of Medicaid are so low that the hospitals are saying that they cannot survive and accept those rates. And then as we speak, also in North California, there are, in the rural area, maternity hospitals which are closing as well. So there was several cases in which the mother in Northern California had to travel many miles and almost died from bleeding because of the lack of hospitals and how far it was. So the children of California depend on Medicaid. 5 million of them do, which is a little bit over half of them. In Orange County, the Medicaid program is a Medicaid managed care managed by CalOptima. And CalOptima has 1 million patients and is serving the children, most of the children of Orange County. I take care of them, and I've been in the community for a long time. The services for preventive care to keep our children healthy, the ones on Medicaid, are really essential because it checks the vision, it checks them for anemia, it makes sure that they grow well, it checks for their hearing, and everything that it takes for a child to stay healthy.
And teeth.
And the teeth. The dent
are so important. And Medicaid covers now dental care and mental behavioral care.
So there are services that in California are expanded. So Medicaid in California versus compared to other states have a larger spectrum of care and provide, like Sandy was reminding me, for the mental health services. We all know how crucial it is, and we know, for example, in Orange County, the typical person, the typical teen who commits suicide is an Asian, 15-year-old, most likely Vietnamese, because Vietnamese represent over 30% of the population of this county, and the largest fraction of Asians in Orange County. So regarding the services for the children, California has a very unique system called the California Children's Services, and it takes care of children who are born premature or with certain problems or who have disabilities. And it does a very, very comprehensive job, as you know, because the children need a lot of services, whether they cannot hear or whether they're born several months premature. So all these services, I'm sure that you all know of, if not within your family, you know of other families and friends who have children with autism, who have children with developmental delay, who are late in talking, and it is really essential for these children to receive the services, to be diagnosed early, and to be receiving the intervention as needed. And those interventions don't stop there. It continues with education. Many people don't realize that some of the educational interventions at the schools for children with handicap are covered by Medicaid. This is very important. Without Medicaid, all that goes away. If you have a disability, if you need speech therapy or any type of therapy, or you need your wheelchair, that's gone too. And that's for all ages. Many of those families need in-home services in which a relative or someone can go to the home and take care of them. That's covered by Medicaid. All those services, which are very extensive, are covered.
Just, sorry to interrupt. We are told by the facility that several people parked in a towaway. And Julian, where exactly is the parking? Because we may need to stop and just make sure nobody has to have their car towed. Do you know where it is exactly?
So I apologize that for those who park on that side, need to move your cars. And we have plenty of parking spaces back here, which are totally that side.
Sorry, let's give them a few minutes. We don't want to have anybody leave and worry their car got towed. This is terrific, really helpful. Sorry. Just want to make sure nobody gets stuck. And do you have a question, Nicole, while we're waiting?
I have a question with Dr. Hughes.
So can you please specify about the mental health issue? You told us about the suicide rates in Orange County.
I'm more than happy to do that. It is documented that.
No, I can't do it. You do it.
So it is documented that in Orange County specifically, the rates of depression and anxiety are the most severe in Asian female. And so in the mental health, we'll report to you, and especially there are some reports from Okapika which documented that. We are the number of children who are serviced, who are Asians, is the highest. And specifically in the numbers of last year, they documented that the Vietnamese female or Asian females, Okapika serves specifically the Asians, are extremely high, including the rate of suicide attempts.
So that's also affected by the medical.
Yes, absolutely. All the mental health services in Orange County are provided are covered by Medicaid. And the funds are, whether under county or Cal Optima, all these come from the Medicaid budget.
Thank you so much.
Okay, please take your seat and we'll start back up again in 3 minutes, okay? I don't want to totally lose our focus here. Dr. Q, one question I have is how are the suicide rates and the attempted suicide rates for teenagers, young people, let's say 9 to 21?
We know that after the pandemic, the rates of mental health issues have risen to the highest possible. It used to be 15%, but now it's almost double, 25%, we can safely say. So as a result of that, the state of California has intensified, has provided and put a lot of funding at the school so that the children and the teens can have access to counseling there. But that still is not enough. Can you imagine that, for example, we need one counselor for 500 children, and we don't have that number even. So then now there are facilities in which that they attempt to provide it by telehealth, for example. So there is myriads of instances that our children are being threatened every day because of those issues in mental health and depression, and we don't have enough providers.
What, as a frontline healthcare provider, doctor, what are you most worried about in terms of the medical professionals you work with? Do you think people are going to be laid off? Not just there won't be money to hire more people, but you're going to lose staff, your colleagues.
Absolutely. We have seen the facilities closing and the access to the facilities. I mentioned 2 hospitals which are closing now, and there are more other hospitals which are going to be threatened. We are seeing that the offices or the outpatient facilities will not have enough overhead to cover the cost. And for example, the pediatricians are always the most affected because the children depend so much more on Medicaid. Usually for an internist it may be 25% because they see a lot of Medicare patients, the elderly, but for the pediatrician it's 35% on Medicaid. And many of the offices in Orange County who serve especially the immigrants and the Vietnamese and the ethnic minorities or the ethnic groups or even have a larger amount.
I think we'll go to our next speaker, and I know there will be, you wanted to say a few words in Vietnamese before the end of your presentation, but also know people will want to interview you one-on-one.
In Vietnamese, your message. What can Vietnamese media do to help?
So thank you for allowing me that opportunity. Tôi đã làm việc ở trong cộng đồng chúng ta hơn 45 năm rồi, thì chúng ta thấy, đã được dịp thấy những con em của chúng ta phát triển ở bên này và nhiều em rất là thành công. Nhưng mà cái ngưỡng đầu tiên, cái bước đầu tiên đó là các em có rất là nhiều nhu cầu. Tôi đã thấy bao nhiêu trường hợp các em chậm nói hay là hơi bị có những cái vấn đề phát triển và những cái giai đoạn đầu, và nhờ những cái can thiệp sớm đủ thời gian và nhờ có được những cái dịch vụ y tế mà các cháu đã thay đổi đời cho các cháu, nhất là trong cái 3 năm đầu tiên là những cái năm vàng của đời sống của các trẻ và của mọi người, thì đó là nó rất là quan trọng là được cái sự can thiệp sớm. Sau đó các cháu đi học thì các cháu mở cái nhịp của các cháu, và nhiều cháu đó chúng tôi biết đó là tương lai của cộng đồng chúng ta. Thành ra từ người già và cho đến các trẻ đó thì đều phù hợp là chúng ta cần phải lên tiếng nói để mà làm sao bảo vệ cho cái nguồn sống và cái nguồn tương lai cho con em và người cao tuổi của chúng ta và những cái người mà đang có nhu cầu nhiều nhất. Thì tôi nghĩ là với lại cái giọng của chúng ta phù hợp và cộng hưởng lại với lại tất cả những cái nhóm khác đó, ở tại quận Cam chúng tôi có thể đem lại một cái sự quan tâm đặc biệt đối với cái chương trình này. Không có cái chính phủ nào mà có thể nói là không có nhận để mà có những cái dịch vụ và có những cái sự nâng đỡ cho những trẻ em mà đang trong cái giai đoạn phát triển mà cần những cái dịch vụ đó. Thành ra là tôi kêu gọi mọi người quan tâm và mình đều cùng một giọng với nhau để mà mình có thể là được cái sự mà ủng hộ của tất cả những cái người dân cử của chúng ta.
Thank you.
I think we should give Dr. Q a round of applause because although I don't speak Vietnamese, I got the message. Okay, now we go to Evelyn Rodriguez, and we have an interpreter, although I suspect she really has better English than she has said. And Evelyn, you run a parent organization. You are extremely concerned about the potential impact that cutting Medicaid could have on yourself and the parents. Can you tell us what you want us to know from your experience as a parent looking at this issue?
Buenos días, gracias por la invitación. Como madre, quiero compartirles que tengo miedo de estos recortes porque mi familia depende de los servicios para sobrevivir. Gracias a Medicaid, mi hijo Benjamín Tiene cuidadores que lo asisten, supervisan mientras yo puedo trabajar, lo mantienen seguro, lo ayudan con sus habilidades de la vida diaria. Tiene terapias que apoyan su comunicación, lo ayudan con sus comportamientos. Michael hablaba de lo exitoso que es recibir terapias. Estoy totalmente de acuerdo. La intervención temprana, las terapias que reciben nuestros hijos con discapacidad, ayudan muchísimo en su desarrollo. También gracias a los servicios de Medicaid, mi hijo tiene acceso a clases recreativas que lo hacen feliz y le permiten convivir con otros adolescentes típicos de su edad. Si se recortan estos servicios, yo tendría que dejar mi trabajo, abandonar mi labor de líder comunitario en mi organización. Mi salud mental y física se verían gravemente afectadas por el alto nivel de estrés que ya enfrentamos diariamente los padres que tenemos hijos con necesidades especiales. Mi hijo Benjamín se quedaría sin los apoyos, servicios, cuidadores que lo ayudan a tener una vida en paz, feliz y sentirse seguro, y lo más importante como madre, estar incluido en la comunidad, como cualquier otro adolescente de su edad. Estos servicios no son un lujo, son la base para tener una vida digna e inclusiva, no solo para él, para todos los miembros de la familia.
Good morning. As a mother, I am afraid of the Medicaid cuts because my family depends on these services to survive. Thanks to Medicaid, Benjamin, my son, has caregivers who assist him while I work and I help him be and stay safe. He received therapies that support his communication and behavior. He also has access to recreational programs that bring him joy and allow him to socialize with other teens his age. As Michael mentioned, early therapy and early detection helps them in all developmental areas. If these services are cut, I will have to quit my job and step away from my community leadership work. My mental and physical health will seriously be affected by the high level of stress which we already face as families raising children with special needs. Benjamin will lose the support that helps him feel calm, safe, and happy, and that allows him to be part of the community just like any other teenager his age. These services are not a luxury. They are the foundation of a dignified and inclusive life, not only for him, but for our whole family. Thank you.
But let's give our community speakers a special applause.
Thank you. Our fourth speaker and her son are going to share their story with us as well. Michelle Del Rosario and William Del Rosario. And William's letter to the local congresswoman asking for support for Medicaid is in your folder. Michelle, thank you for joining us. I don't know if that works. Maybe it does. Please.
Hello, everybody. Thank you for having us here today. I'm Michelle. I'm William's mother. We are a family in Orange County, served under Congresswoman Young Kim's congressional area. I have been a member of the Orange County community for some 50 plus years.
You don't want to tell us exactly.
Okay. But I will add that, a little bit about me. My father and mother were from Texas. and they were, when the United States acquired Texas, they were Americans, so we've been here, we are not immigrants. But they have served, in the migrant farming industry when they were younger. And my father in particular grew up during an era where people were segregated based on the language they spoke or the color of their skin. And as many of you probably already know, we went through the civil rights movement. That was very hard. And what made change? Grassroots change. People letting their voices be heard to the representatives, people asking for a change and doing so in a way that put a face of humanity to the need. When my father, later on he went to college and he became an educator. So that brought our family here to Orange County. He was a Spanish teacher, English teacher, history teacher, and I think, if I'm not mistaken, 50 years ago, when the fall of Saigon happened, I think it's April 30th, 1975, right? So 50 years ago, he was faced with a change of path in career. He was an English as a second language administrator with the school district, and here we had many new community members who spoke a different language, who had a different culture. It would have been really easy for my father to stick with what he knew well. He knew the Hispanic community. He knew Spanish very well. But I learned a lot from my dad. He was a leader. He knew that he needed to go out and immerse himself in the communities that he was representing, to learn more about them. The Vietnamese community embraced him, and in turn, as a young girl, our family was embraced. We attended your cultural events. Many of the Vietnamese community became members of our church. And a beautiful thing happened. We became a trilingual community at our church and in the community I grew up in. We added many other different ethnicities. Looking around this room, I see many of you, and all of us have a need. Here we are with my son, who he is an individual with autism and epilepsy. He'll share a little bit more about that. But yesterday we had an announcement that the prevalence of autism has increased to 1 in 31. The numbers are increasing of individuals with autism. Now is not the time to be making cuts to the very services, as Dr. Q spoke of, that are getting early diagnosis, getting those crucial interventions done. It's estimated this year, if I read correctly, that California will be adding 40,000 individuals approximately to receiving regional center services, bringing the total of Californians with disabilities up to over 500,000. These numbers, don't quote me exactly on them. These are early preliminary reports based on that announcement yesterday, but looking through those reports this morning, and I also read one that said that for the first time, there is an increase in autism higher than other ethnicities in the Latino and in the Asian and Pacific Islander. I think the head nod. So those reports, I believe, are credible and valid. And so we have to look at our own community. We are a community that is different in a lot of ways, but together, I'll quote William, who says, "We are the difference. We are not the difference." Now is the time to come together for the common good and the needs of the community. We cannot fail these children. So without further ado, I'm going to go ahead and let William speak his part. So bear with me on the technology. Let's see if this works.
Good afternoon. My name is William Del Rosario, and supporting me today is my mom, Michelle. I am a 24-year-old non-speaking adult learner and self-advocate with autism, living in Orange, California. I have autism and apraxia, and I am a multimodal communicator who uses augmentative and alternative communication, AAC, through typing in my iPad. While my learning and communication differences are an important part of who I am, they do not define me. As an adult working toward greater independence, I rely on crucial support systems. I am one of more than 150,000 people in Congresswoman Kim's congressional district with a developmental disability, and I am here today because I need your help to protect Medicaid and prevent cuts to the services that support us. Let me explain how Medicaid impacts my life. When I was younger, Medicaid waiver programs through the regional center made it possible for me to receive therapeutic services such as applied behavior analysis, which greatly improved my quality of life at home and in the community. I rely on Medi-Cal to stay healthy and manage my complex medical needs, including epilepsy. Without Medi-Cal, I would not be able to afford the medications that have kept me seizure-free for the past 12 years. Currently, I live at home with my parents, who support me in all areas of my life. However, there may come a time when they are no longer able to do so, or when I am ready to move out. As we plan for my future, we are working with the regional center to design a person-centered plan that supports my goals. This includes onboarding and training staff to help me maintain my health, access communication, explore further education, seek employment, and build a meaningful life in the community through supported living. However, this plan is only possible with critical Medicaid waiver programs, such as regional center and in-home supportive services, IHSS, which fund the staff I will need. Without this funding, my quality of life will drastically decline. Instead of thriving as a valued member of our community, I will be left to silently exist. Can we count on your support to prevent cuts to Medicaid?
Very eloquently stated. We are close now to our last round of questions, then break for individual interviews. You, as always, are a great audience, but we have a fantastic panel. I have one last question and then want to know if anybody else. I have a selfish question. I am old. I am old, according to AARP. And I think, as William thinks, what will happen when I am no longer able to care for my needs, and if there are dramatic cuts, for example, my husband's pension after his death as a longtime professor at Berkeley, I would be in great need of Medicaid. What will happen to the home health care services for older adults who are either living in assisted living facilities, otherwise known as nursing homes, or isolated in their apartments or housing? How are older adults, Michael, being cared for by Medicaid now, and what will happen to us?
Okay, I think this is not entirely my area of expertise, but
I know you're a children's advocate.
Medicare is the program for older adults. However, Medicare does not cover nursing home coverage. So many seniors get some of their care through Medicare, but actually rely on Medicaid or Medi-Cal to pay for that nursing home care, which we know is so important. So it's critically important for seniors.
And Dr. Q, do you want to, I know you're a pediatrician, but as a healthcare professional, what will happen to older adults, and particularly Vietnamese who came in the 70s and still, thankfully, are with us?
So according to, I have here, it's in Vietnamese only, but I have listed many acronyms of the different organizations that are supported by Medicaid, and I'm sure that all of you will recognize many of them. One, for example, is called PACE, which is specifically for the elderly, and he picks them up and takes care of, they have centers and facilities where they make sure that they get preventive health. Many of the portions of the Healthcare Act, and for example, the maintenance of health is, at some point, is not covered by Medicare, so but Medicaid picks up the difference. So as you get older and there's more disabilities, Medicaid fills in all the gaps. So
it is the safety net.
Absolutely.
Okay, great.
Any final question before we break? And I want to ask our co-director, Julian Doe, also if he has questions. Nicole, you have a question.
Thank you. Any of panelists can answer. I'd like to know, you are we are here as a representative Young Kim's area. Have you ever contacted congressman or district representative to help to preventing medical costs?
So that's a very important question. How much outreach has been done in terms of trying to persuade or educate Congresswoman Kim on the community's concerns?
Yeah, I think we have been loud about letting the Congresswoman and other members know. There's a rally actually tomorrow at the Anaheim Hills office, telling her not to cut Medicaid for kids. I know there's other events happening around individuals with disabilities. And I know that there's a lot of individuals like William who are communicating with the congressperson to let her know how they feel. So there's a lot of events happening and a lot of communications happening to let her know just the devastating impacts it would have.
Michelle, William wrote his essay as a letter to Congresswoman Kim. Imagine if she saw that letter in a Korean language newspaper. It would be very powerful. Have you had any direct dealings with Congresswoman Kim?
So William was typing, so I was trying to listen. Hold on a second. Okay, go on, that's all you have to say.
We have met with her representative.
So yes, we have met with her representative in a focus group and shared this similar message. William also spoke at a, I think it was called Congresswoman Kim, We've Saved You a Seat, a town hall meeting, to share our message. Unfortunately, she did not attend, but I'm hoping that she is paying attention to her constituents, and we would welcome that opportunity to speak.
In a way, our media has always been advocacy media. If you think of the very first black newspaper, Freedom Journal, 1827, we wish to plead our own cause. Too long have others spoken for us. It was the voices of ethnic media that made such a difference for so long. Think of Wen Ho Lee. I always think Wen Ho Lee would still be in prison if it hadn't been for Chinese language media. Julian, do you have final words, thoughts to add, or a question?
Yes, thank you, Sandy. So I think so far our discussion has been focused on how the cut will impact many patients and families in diverse communities. But I think there's one point maybe we can also emphasize is that we are also taxpayers. We pay taxes, and these are due benefits to us. So it's not like we are at the mercy of some altruistic program, and so we deserve this. And I think that point should come across stronger. We are taxpayers, and we are also voters. And I think that's something that you might want to emphasize more. Thank you.
Thank you. Look, we're going to break now. Please ask questions from our guest speakers, and also enjoy a sandwich, coffee, water, and cookies. And no, we're very grateful to all of you for coming to this important briefing. Thank you very much.
I have some handouts here for my Vietnamese